Hello, this is Dr. Zachary Ward with the Life in Alignment podcast. This podcast is packed full of what I believe to be critical information for your health. This show is not long, but it could have a lasting effect on your life. What is on today's show? Well, usually I try to talk about 2 or 3 different topics. Today we're largely going to be focusing on the topic of scoliosis because it's such a broad topic. And there's some interesting things that I believe most people should know. We're going to be talking about the 3 big lies that people believe about scoliosis. Are there only 3? No, there's actually more than that. There's about 10 big myths that both doctors and patients believe about scoliosis. Today we're only going to focus on 3. If you're looking to find out what those other 7 are, you can go ahead and contact me, and I will send you that information. Second topic is just a slight spin-off of scoliosis, and it's entitled, "What About My Spine, Doc? Are Children's Ears more important than their spinal alignment?" You would think based on how much importance we put on ears and lungs and heart in the child physical or the new student physical or the exercise/sporting event physical, that the spine really doesn't matter. But it does, and we'll kind of talk about that a little bit. And if you are listening to me because you found me online via podcast link or perhaps on YouTube, thanks for listening. If you're in my geographic region and you want more information about my practice, I am an upper cervical chiropractor practicing in Auburn Hills, Michigan. For any information on anything I'm sharing with you today, please go ahead and contact me via my website. That is liachiro.com. That stands for LIA Chiro. There's a contact form on the right-hand side of the page. You can use it, reference this podcast and the information that you're asking about, specifically scoliosis in this case. If you are a patient of mine and you're listening to me, perfect. Glad to have you. Thank you so much for investing in your health with me, especially via this podcast. Let's go ahead and get going. The big lies people believe about scoliosis. Are they affecting someone you know? Scoliosis, what is it? Why do we believe so many untrue things about this condition? Well, part of it is because it's a confusing term. So let's go ahead and clear it up. Technically, a scoliosis is any kind of curve in the spine that is a lateral curve, or a curve that we see when we look at the spine from the back. In the picture-perfect spine, there wouldn't be any curvature at all, except for the normal front-to-back curves like we have in the neck and the low back. So if you have a small curve in your spine, then you are correct to technically say that you have a scoliosis. But you definitely do not want that diagnosis following you around unless you actually have a large side-to-side curve in your spine. So what most doctors and healthcare providers and health insurance industry people mean by scoliosis is curvature of the spine of about 15 degrees or more when it's measured on an x-ray. But even if you have a curve in your spine of 15 degrees or more, that doesn't mean a scoliosis is a scoliosis is a scoliosis. Not all scoliosis cases are the same. So what does that mean? Well, you can have a functional scoliosis. This is a small curve in the spine recognized as being only muscular, because when you change position, the curve disappears or greatly reduces. For example, if you stand up for an x-ray and you have a curve in your spine, and then you lay down for an x-ray and that curve disappears, that would be called a functional scoliosis. Again, it's recognized as being 100% muscular. It's usually small. Functional is the name. Most people with a small curvature have a functional kind of scoliosis. Many of these respond very well to specific chiropractic care. You can have what's called a congenital scoliosis. This is the opposite of a functional scoliosis. This is where the actual spinal bones are shaped differently. There may be an extra bone in there, maybe an extra lumbar. There's something called a hemivertebrae, where the bone, only one half of it forms fully. And so the structure, the bony structure itself, is inherently different in some way. I'm not going to use the word flawed. It's just different. It's a natural variation within nature. And it creates curvature, and it's called a congenital scoliosis, and this is pretty rare. And no amount of chiropractic adjusting is really going to change the shape of the bone and really change the degree of the curve. That doesn't mean that people who have this can't benefit from chiropractic care, because obviously they have some different structure in their body that may mean that they experience stress differently. So there's a possibility of chiropractic helping them. We're just not going to be looking for the changes in curve or any kind of structural correction. You can also have what's called idiopathic scoliosis, and this is the condition that most people talk about when they talk about scoliosis. It is not congenital. It's not caused by the shape of the spinal bones from birth, but over time it can change spinal bone shape, and it's not functional in the sense that it's not recognized as being just improper muscle tone. There's something a little bit deeper going on within the nervous system. Idiopathic means that we don't know what causes it, so you can remember this phrase, idiopathic, the doctors are idiots, so they don't know what causes it. You'll always remember what the term idiopathic means. So this is the condition that most affects adolescents, especially preteen and early teenage girls. And this is the kind of scoliosis that is most confusing. And its care is often full of well-intentioned little fictions. You might call them lies. Many doctors and patients believe. So what are these lies and myths? Well, there's 10 major ones. I'm going to cover 3. You can certainly request getting the rest of the 7 of them from me by contacting me via my website. So big scoliosis lie number 1. Scoliosis is a cosmetic problem. Treatment isn't optional. Here's the truth. Worsening scoliosis can be a life-limiting condition. There's a group called the National Scoliosis Foundation, and they say right on their website that scoliosis is associated with headaches, chronic pain, digestive problems, shortness of breath, chronic disease. Scoliosis can limit your height and your normal growth patterns. Over time, what might impact people most of all is scoliosis can reduce the ability of the lungs and heart to function normally. Big scoliosis lie number 2. Scoliosis can't get any worse after a child stops growing. So once you're skeletally mature, no more scoliosis worsening or increasing of curvature. And that's just simply not true. The truth. Scoliosis curves can continue to get bigger and worsen into adulthood. In 6 different studies across several decades, researchers measured the spines of adult scoliosis patients and found that their scoliosis progressed. In 60 to 100% of scoliosis cases of skeletally mature persons, the curves in the spine continued to worsen over time. Close to 600 spines were examined with all of the studies combined. So in other words, in some of those studies, there were probably just a few people sampled and 100% worsened, and in other studies, there were a larger amount sampled and perhaps only 60% of those studies, somewhere in there, in that range. There was worsening of the scoliosis measurement in adulthood. On to big scoliosis lie number 3. Scoliosis is a bone problem. Treatment should be by an orthopedic doctor and be focused on the spinal bones. Well, that's a lie. The truth is scoliosis is a nerve system problem. It's a dysfunction of the nervous system. So if you or a loved one has received a diagnosis of idiopathic scoliosis, that the spine's curvature cannot be blamed only on the shape of your bones. This is not a bone problem. There has to be a problem in the balance of the postural muscles of the spine. Because the balance or tone of the posture muscles are controlled by the nervous system, scoliosis involves the nerves. For some reason, there is a miscommunication between the nervous system and the muscles of the spinal column, specifically in the proprioceptive system. The spine is not as in control because the brain is not in control as much as it should be. So to address scoliosis and only think about bones leads to healthcare that does not address the whole problem. A comprehensive plan for scoliosis should attempt to improve the communication between the brain and the nervous system and the postural muscles of the spine. Specific chiropractic care is critical for providing a comprehensive plan for people with scoliosis. Upper cervical chiropractic care specifically is incredibly important because of the way the upper cervical nerve system influences and controls posture muscle tone. In fact, getting a young person with signs of scoliosis under upper cervical chiropractic care early enough may actually prevent or delay its development altogether. So a little bit of a commercial for my practice. I do scoliosis screenings for school-age children up to the age of 18. And the ideal time is before adolescence starts, before something like this takes off. While there are some great pediatricians out there, and many of them are trained to, kind of glance down the spinal column, a once-over brief scan is not enough to detect some of the earliest hints of idiopathic scoliosis. So, if you are listening between now and September the 15th, 2013, I am offering a complimentary scoliosis screening, which includes a low back x-ray for school-age children. You can also request a scoliosis information packet, which includes a brief handout about these big myths that people believe about scoliosis. And it'll include a certificate to be checked by me, including the lumbar thoracic x-ray, again, if this is before September 15th, 2013. It's certainly easier to grow a child's future than it is to repair an adult's past. Which brings us on to the next topic. Are your children's ears more important than your spine? You'd probably think that, wouldn't you, based on the amount of attention that we give to children in certain body parts over others. So your spine and your child's spine. It's like 24 different stacked chairs, the vertebrae are. Joints that glide and rotate, trillions of nerve fibers. Doesn't your child's spine deserve as much attention as his or her ears? Well, I like to think so. So when I'm recording this, it's physical time. This means that kids everywhere are having physicians look in their throats, their ears, and listening to their hearts. But when is the last time your doctor examined your child's posture or assessed the health of his or her spine? If all she's gotten is that once over check for spinal scoliosis, then maybe it's time for her to get checked again. While children typically don't have the same kinds of pain as adults, they can still have pain, and they still have the same hectic schedules, carry the same loads, and sit for hours in the same desks and chairs. They really put their bodies through the same rigorous sports as well, and that means that they can have adult-like problems. Adult-like problems like headaches and neck pains and breathing problems and digestive issues and problems that originate in troubled spinal alignment. So after your doctor looks at your daughter's ears and checks your son's lungs, listens to their heart, why don't you head on over to your doctor of chiropractic and make sure your child's spine is okay too. You may find that those adult troubles go away as easy as 1, 2, 3, and that will help your child become a kid again. Again, this is Dr. Zachary Ward with Life in Alignment Chiropractic. This is the Life in Alignment podcast. If you're listening and you are a current patient, thank you so much again for listening. If you're in my geographic area and like more information about my practice, please go ahead and go to liachiro.com and contact me that way. If you're anywhere else, just thank you so much for listening. Look forward to speaking with you again.